topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good morning. I'm going to say Texas, not just Dallas, Texas, but the great state of Texas. Good morning. Welcome to another Ask the Expert show where we bring you the top experts in the field of legal, health, financial, and home improvement. You know, YouTube and Facebook always, a lot of you find out about what shows are coming on as they promote these shows. And it's so amazing. They started promoting this morning's show several days ago, and we promoted also. And I can't believe the people. There's a lot of people out there that either are suffering from neuropathy, know somebody, or think that they might be. And we saw this trend happening. And we were able to secure Dr. Tim Uselton, one of the top doctors when it comes to treating neuropathy. And we just decided that not only are we going to run this show live, which we're doing this morning, but we're going to take this show and run it again in 2 weeks. And we've also made it to where it covers the whole state of Texas, because we know that there might be somebody in Waco, Texas, who are going through the painful neuropathy that doesn't mind the drive to Dallas or can do it through telemedicine. But I am so glad that we have an authority on neuropathy. Let me welcome Dr. Tim Uselton. Good morning, Tim.
Hey, good morning, Steve.
Well, I got to tell you, we do a lot of research every day because we're in 50 different states, and gosh, Tim, neuropathy is becoming more top of the mind. You are so smart. You're a chiropractor by trade, and I got to tell you what chiropractors have done, where you've come to today, where versus maybe 20 years ago, it is amazing what you all do. But you have taken it a step further. You really concentrate on the horrible, painful neuropathy. And what we use this show for is to educate you what it is. And Tim's office is in Carrollton, Texas. I got to tell you, I love this show so much, I don't even need notes for it. I know Tim so well, and again, this show will be repeated in 2 weeks, but you can always go to iHeart or YouTube and listen or watch the show again. Tim, tell people about your practice, first of all.
You bet. We're located here in Carrollton, like you said. We've been here going on 30 years now. And I started as a chiropractor that was mainly working on necks and backs. And as we grew and moved from one location to a bigger building to then a third bigger building, we were able to expand our services. We became a medically integrated clinic, which means basically that I have an MD partner. So it's a chiropractic clinic and a medical office all in one. But we kind of agree on the philosophy that we're not going to just treat people, their symptoms with pain meds or with things that just cover up. And when it comes to neuropathy in particular, the number one treatment out there is a drug called Neurontin. You may have heard of it, called gabapentin. It's the same thing. And so after seeing so many people over the years come in on gabapentin and complaining that it wasn't working and it was hard to get off of because they were almost addicted to it, I said, you know what, there's got to be a better way. So I started the research then. Back in 2018, I become board certified in peripheral neuropathy and chronic pain management. And our approach is a drug-free, surgery-free approach to it. And so over the last, let's see, 7-8 years now, we've been able to develop some protocols that really, really do help people with neuropathy, which basically, if you don't understand neuropathy, to sum it up, it's when the nerves that are furthest away from your heart die, and they die because the blood flow is poor. As the blood flow decreases, the further away from your heart's trying to pump blood, the more likely it is to have damage, and then the nerves begin to die. So we're all about things that promote and increase blood flow, and we can do that a litany of ways. And we've talked in the last month or so about how we can do it without patients even coming into our office. We can do telemedicine and then send them some of our information and some of our devices and some of our products, and really see them take steps towards getting the feeling back or the pain decreased from their neuropathy. It's been
So
exciting.
when you're saying furthest from the heart,
Yep.
so feet, is that a big
That's right.
area?
Feet are the most common. It starts in the toes, works its way up to the bottom of the foot, sometimes the entire foot. Sometimes if a person just kind of lets nature take its course, they come in and they're numb from the knee down, even the entire bottom of their leg. And then other people, it starts in their fingertips. For whatever reason. But again, it's the heart pumping blood into all these areas to supply oxygen and nutrition to the nerves. And when the blood flow is decreased, the oxygen and nutrition is decreased. And when something doesn't have oxygen and nutrition, it dies. So the nerves begin to die, and we need to promote blood flow back into that area. That's a term called angiogenesis, angiogenesis, angiogenesis. And that's just the promotion of brand new blood flow through arterioles and through arteries into an area in the body. There are lots of things that can promote angiogenesis, and that's what we concentrate on.
So I'm going to start off backwards and go, tell people what could happen if they don't get treatment.
Great question. And I get that a lot. What's going to happen, next year or the year after or 5 years from now? And the actual answer is not good, because when it's classified as a degenerative condition, by definition, that means it's going to get worse over time, not better over time. Some things, you get a little injury to an ankle, or you sprain an elbow, or you pull a shoulder muscle, and you do nothing about it. You forget about it. You kind of let nature take its course, and then voila, it feels a whole lot better. Well, that's something that your body is kind of healing the soft tissue. When it comes to dead nerves, they get worse. And as they get worse, they actually will end up amputating toes. That's why, if you've ever known someone that had a toe amputated with surgery, it was because the nerve was so far gone that they couldn't bring it back. And oftentimes, amputees, people that are the victim, I should say, of having their toes be cut off, or even their foot, those people are on drugs like gabapentin the entire process, because gabapentin is not a drug that heals or creates angiogenesis or addresses the problem. It just numbs you. It slows down your neuropathy, your neurology, to understand that you just don't feel it as much as you did before. So you go, okay, I'll go about my business because I don't feel my numb feet or my painful toes anymore. But really, it's just the connection between that symptom and your brain perceiving it that the neurontin or gabapentin is actually addressing. And so people continue to take the drug and continue to decrease in their blood flow. They continue to degenerate with their nerves, and then eventually they wind up cutting them off. And that's called an amputation. We don't like that. We like to avoid that. We like to catch people way before that. The sooner you catch the neuropathy, the easier it is to treat. Now, it's never super easy to treat. It is a difficult condition to treat. But when it's too far gone, we've had patients that wound up coming in here a little bit too late. They couldn't stand. They lose their balance. They can no longer drive. I met a lady the other day. Actually, I met her husband, and he was telling me my wife hasn't left our house now in like 6 or 8 months because she's in a wheelchair and she doesn't move. She can't move her feet. She can't stand up. She doesn't want to risk it on a walker and fall and break a hip. So it's very quite saddening to hear the stories that are really, really prominent, because about 30 to 40% of people over the age of 65 suffer from neuropathy. That's like 1 out of 2
Wow.
almost that you see.
You know, Tim, I wish maybe if you would, I don't want to put something on you haven't had time to research, but the name in Dallas is synonymous with the Dallas Cowboys. And I understand that Prime had some toes amputated,
You
and
know,
they never really said what it was. I wonder if that was neuropathy that he
that's
had.
a great question, and I should know the answer to that. I'm a big Deion Sanders fan,
Yeah,
and
he had some
I
toes
was hopeful.
amputated.
I was hopeful he was going to become the Dallas Cowboys' next head
I
coach.
know, I know.
McCarthy, by the way, I'm a Cowboys fan right here in Dallas.
So am I, Tim.
But yeah, I've read stories that he had toes amputated, and that's why he kind of walks with a limp now. I'm not sure if that's
Yes.
diabetes related, which is peripheral neuropathy, or diabetic neuropathy, or if it's. I remember as a player way back in the mid '90s when the Cowboys were winning Super Bowls, he had foot injuries. They were the thing that really
Oh,
slowed him down, like turf toe, which is where you strain the bottom of the foot and that plantar fascia begins to rip away from the toes and you get a lot of severe pain. So if that kind of started his, and then he has spikes in his blood sugar over the years, I'm speculating because I don't know the details. He's kind of kept that on the down
yes.
low. If you Google it and search for it, you can't really find out. Some people say, yes, he had surgery and removed his
That's why
toes.
I didn't know if it was neuropathy. I just knew
Sure.
he had a couple toes amputated, and they were even thinking about amputating some more, but they were able to save him. But they never said what he had, though.
Right. Yeah, it's very likely and possible. Diabetes is the number one cause, and the reason being is when you are diabetic, if it's uncontrolled, you have these tremendous spikes in your blood sugar as your body's no longer regulating that with insulin, and so those spikes leave a ton of inflammation in the body, and that inflammation kind of attaches itself to those blood vessels and the supply to the nerves. And as those blood vessels get really inflamed, they begin to diminish and their blood flow into the nerve diminishes. And once you diminish the blood flow, the nerve starts to die. So we always want to bring it back around to increasing blood flow, which is angiogenesis, or another term for it is vascular, like neovascularization. That's new blood flow to an area. And so that's kind of what we concentrate on. I would love to have seen Prime Time himself if I could have been able to help him at all, because he might still be running super fast with all of his toes. I'm
Yes, I
not sure.
know.
I see him now and he's limping, but yeah, it can do a lot of damage. And he's not an older gentleman. He's not a
No.
70, 80-year-old person that we typically see in the office with this. It seems like it's happening younger and younger these days.
So, Tim, we're getting a lot of texts. People want to know, what if they live outside the Dallas-Fort Worth area? How do you treat them?
Great question. So we do have a couple of devices that are FDA cleared that we know promote angiogenesis and neovascularization. That's one component of it. If we can address the nerve and the blood flow to the nerve at the site, well, then we can handle that and create some new blood flow. The second thing is very, very important, and that is that your nutrition, that your gut health is good. If your gut health is wrong, if you have a little bit of leaky gut syndrome, which is very, very common, it's going to cause all that inflammation to return. Without super good gut health, then it's like you're in a boat and the boat's taking on water, and instead of patching the holes in the bottom of the boat, you spend all your time scooping water out with a pail. And so you're bucketing this water out. It's a never-ending story. If you only address one component without addressing the other, you're just chasing symptoms. Now, these are good things to chase. We're trying to get blood flow back in the area. But if on the back end, you're letting the gut leak and it's no longer providing good nutrition, we can stop that with some good nutrition, with some good support. And I mentioned to you earlier, but not on the air, that recently, if you actually can be in the Carrollton area of Dallas, we're getting some tremendous early results with some IV nutrition therapy. So instead of
which we
supplementing,
talked about.
by taking a pill or a supplement, a vitamin, a mineral, we can actually infuse some of those directly into your blood flow. We hit a vein, we do an arterial venipuncture, and we drop that nutrition directly into the bloodstream. And it takes a little bit less because you're getting it directly to the spot. If you ever take a pill, then you get about 50% of what that pill says you're taking, because your stomach has to break it down and then it loses its gusto. And if you take it like it's maybe a sublingual or something that dissolves into your bloodstream, you might get a little bit more of it. If you take it as a powder that you don't have to really break down the pill with all the polymers in the pill, you can actually swirl powder around in a glass of water and drink it, and that gets a little bit better absorbed. But by far the best absorption is always right directly into the vein. If you've ever known someone that had a massive sepsis or a huge infection and they're in the hospital, they're putting an IV in them and they're dropping antibiotics directly into their vein, and they're doing them hardcore. You're getting about 99 to almost 100% of everything that you put through the tube when it goes in your vein, as opposed to putting it in your mouth and letting your body digest it. So we're getting good results. A couple of shows ago, I mentioned that we get some results sometimes with a product called alpha lipoic acid, ALA. Alpha lipoic acid. And you got to take a lot of it, though. You got to take like 3 or 4 times the recommended dose daily for about a month before you can see any results with it. But if we drop
Over the counter, Tim?
it is over the counter. It's just a supplement, alpha lipoic acid. But if you want to really jumpstart that, put some alpha lipoic acid in an IV directly into your venous return, and it'll go to your heart and pump it everywhere, and it'll go to the most distal ends as we're trying to improve the blood flow to those distal ends.
Tim, we always like to answer questions that people send into the chat. I kind of know the answer to this, but if you could, do you see on the chat? It's from Shay. All this you were talking about, if someone had chemo, is in a wheelchair now, could you help this person walk again?
That
Probably
is
need more information, huh?
Yeah, I would need more information, but I would tell you there's hope, because chemo-induced neuropathy is one of the things that we had in our board certification. It's a very true thing. When chemotherapy is introduced to the body, it kills good things. It decreases blood flow to nerves, and people then have chemo-induced neuropathy. And so without the chemo, they may not have ever had it. Now, it's a challenge because people oftentimes are on the chemo for X amount of time, and then they're off for X amount of time. And it's best to really treat it in that moment of time when they're off of the chemo. And then they may be getting back on chemo for another round or another couple of rounds. So in between the chemotherapy is when we would get the best results. And so I would never, predict or sit here and say, I can see the future and go, yes, you will walk again. But you know what? Doing nothing, I believe, inaction or procrastination, I call it perfect procrastination. It gets you nowhere. I'd rather do the action and it be one that we're not sure if it's going to work, but we're not sitting around to know what, the end result of the other thing is that you're not walking. So if we can
Like
try
the lottery, if you don't play it,
like
I guarantee you'll never win.
you'll never
I
win.
guarantee you.
That's right.
We got another question here. It says, Tim, if anyone has been through cancer treatment over 67 and cannot walk but has leg and foot movement, would you be able to work with them? How long would it take to get started?
Oh, that's a great question. And
Yeah.
absolutely, we work with people on the regular that come in here that need assistance getting out of their car. They're no longer driving. They're either in a wheelchair or on a walker. And, we get them into our process, and the process is very quick. I mean, we have same day appointments available. Our doctors are here full time. And if we're open, you can get in and see one of our doctors. So as far as how quickly could it get started, if you're in the Carrollton area, as quick as you could get here. And secondly, um, we have had some really great success stories with our treatment plan. And we've had people that have showed up on a walker and then progressed to a cane and then progressed to no assistance whatsoever, fully on with their balance. One gentleman in particular, his last name was Williams, I remember. He knocked on my door because I was in outside of the treatment area at this one point. Normally I'm out and about with all the patients, but at this moment I was inside my door and I hear this knock, 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 knock. And I open the door and it's Mr. Williams. He's standing there doing a little dance. And I said, wait a minute. Whoa, whoa, whoa. Just a couple of months ago, you were on a walker. And he goes, yeah. And then a cane. And now I'm off of that and I'm driving. So we were able to get him
Wow.
off of the medications and really pour in enough blood flow to help those nerves feel like they were alive again. That's the beauty of regeneration. It helps things become alive again through angiogenesis, sometimes through regenerative medicine, and now sometimes through the IV therapy with the special neuropathy blend that we put in the IV bags.
Well, the questions are pouring in, Tim. People love your show. Look, Pam just asked, how long had this process of the vein been going on? I guess
Okay,
that's
so
the
if I understand your question, you're asking about the treatment.
I bet that's what it is.
We've been doing the IV treatments in our office since September. So we've completed about we're in our 6th month. So that's for what we've been doing. But these protocols have been out for a couple of years for sure. One of the trainings that we're constantly doing continuing education and trying to, just expand our knowledge and expand what's out there, and medicine and technology seems to always be changing. And one of our core values at this clinic is that we're innovative. And so what does that mean? It means that we're out there on the edge, on the cutting edge, so to speak, of if it's new, if I can prove that it's been researched enough and it's not totally experimental and we're going to be gambling with someone's health. If I can see white paper reports on it, I do a lot of study. I do a lot of research into those studies. And if there's something out there and it's not very popular, that doesn't mean that I won't try it, that I won't figure it out and make sure that it's there. So this treatment and our training, back to that, we started training last September, and we trained with a company that actually has been doing this nerve protocol for probably 3 or 4 years now. And it's just not heard of. When you go to IV therapy clinics, you can't really go in there and say, I have neuropathy, because they won't diagnose you. They won't do blood work in advance to see where you're deficient. It's like you're going into a McDonald's and you're ordering off a menu when you go to IV therapy clinics, and they're popping up everywhere. In Dallas, there's one every other block, it seems like. All these little chains of, they call them drip bars, instead of like a bar where you go order an alcoholic beverage. You go in there and order a cocktail that they put in your vein. They're often called Myers cocktails, immunotherapy cocktails, infusion cocktails. But ours have really good solid stuff in them, anti-inflammatories, antioxidants, and then we'll add some alpha lipoic acid, which is known to help regenerate nerve tissue. And so that one, like, if I'm answering the question and reading it right, how long has this been going on? It's been going on for a number of years, but it's not as popular as it's going to become, I believe. It's kind of on the cutting edge. But if alpha lipoic acid has white paper studies that supplementation of a pill of alpha lipoic acid has helped people, then there's no doubt that putting it in your bloodstream, as long as it's safe and cleared, which it is, then it's just going to be better. It's anything you put into the vein is going to be better than putting it into your mouth.
Tim, I'm going to share something I've never shared with you before, and I think it's probably the right time getting all these people, first of all, enjoying the show. We we have had so many people tell us that they contacted their doctor and their doctor said there's no cure for neuropathy. And I got to tell you, we have learned from Tim. We also do a show in Arizona and one in California. I'm going to tell you something. There are doctors like Tim who specialize in this area who they know neuropathy, and your success rate is incredible, Tim.
Yep. And I
Did you know
appreciate.
there's doctors telling people out there there's no cure for neuropathy?
Yep. Unfortunately, it's true that doctors are out there saying that, and just because they don't know of any cure
Right,
doesn't mean there's no cure. I mean,
exactly.
if you interview Miss Ernestine, one of our last 5-star reviews that we got, um, it was I couldn't walk, and I had pain throughout my legs. I had decreased blood flow. I had swelling. I had almost to the point of skin irritation and lesions, and now I'm graduated from the program. Now this has been about a year in the works, but trying to convince her that there's no cure, she would just say you're flat out wrong. And I have story after story, and granted, anecdotal stories sometimes people fabricate or they but you know, we don't coerce people into telling others a lie. We say, tell others about your experience with the neuropathy
Exactly.
treatments in our office, and they get on. And that's why I've got 170 or 80 in the last year or two, 5-star reviews that say I'm totally in a different direction now. I don't even look the same direction. I'm going this way. I'm walking more. I'm doing the things that I thought I would never do again. And we hear that time in and time out. So
Tim, I've got 1,000 more questions for you, but this show goes by so fast. Tell people that are listening on radio right now or iHeart how they can reach you.
you bet. Probably the easiest way is just remember the website. You can go to Trinity Integrated Medical, trinityintegratedmedical.com. Integrated is spelled INTEGRATED, integrated, like we've integrated medicine and physical medicine and chiropractic and alternatives without drugs or surgery all into one clinic. So it's an integrated clinic, trinityintegratedmedical.com. And once you get there, you can not only meet us, you can contact us, you can read all about neuropathy treatments, you can read about the latest and greatest things that we've introduced with IV therapy. You can even see some of the devices that we may or may not recommend, depending on your case, that we could ship directly to you. And so, yeah, the easiest thing to remember is my name, Tim Usselton. You can Google that, and that'll find our website. You can also look throughout YouTube if you ever are searching on YouTube. I know that the YouTube generation used to be the younger folks, but now the YouTube generation is becoming the elderly. And
Yes.
I have 80-year-old parents, and they're on YouTube every day. And I say, Mom, where did you read
This
that?
show's on YouTube.
Oh, I watch it on YouTube. So, you know,
Yes.
they're proud of the fact they can control the computer to get into the YouTube, but the information they're getting, now you never know what you're going to get on YouTube, but my stuff is there and it's all backed with research. You can go to my YouTube channel and read and watch me explain neuropathy. If this is interesting to you, I can break it down, and I've done so in many, many videos, everything from the foot pain to the knee pain to the neuropathy in the arms and legs, and all the ways that we can fix it. So yeah, remember my name, Tim Usselton, Usselton, or my integrated website, trinityintegratedmedical.com.
And we'll be replaying the show in 2 weeks from today at 9 o'clock Central Time. Tim, thank you so much. You would not believe all the calls that are coming in thanking us for this show. Thank you, Tim. We'll see you next month with your live show.
Okay. Take care, everyone.
That's Dr. Tim Usselton. We're going to go to a short break. We'll be right back.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.